If you're experiencing a decline in your sexual performance, it would be logical to ask yourself a question: why? Of course, it would be easiest way to just start taking mainstream medications like Viagra and Cialis and hope it helps, but even if your erection improves with medication, this type of treatment is not targeting the root cause of the problem. There are many well-known conditions that commonly cause erectile dysfunction. Emerging research suggests that in many men, viruses can play a major role in development of this condition. Hi, I'm Dr. Arkady with ReBalance, and in this video, I will tell you all about those viruses, how they affect you, how you can put them under control, and fully reverse your erectile dysfunction once and for all. Researchers have found that there are certain viruses that can induce the systemic inflammation, impacting your blood vessels, nerves, and hormonal balance, the three pillars that are crucial for maintaining a healthy erectile function. Moreover, the systemic effects of viral infection can compromise the endothelial function, the inner lining of the blood vessels, leading to reduced blood flow to the genital region. This compromised blood circulation can significantly contribute to erectile dysfunction, as a robust and sustainable blood flow is essential for achieving and maintaining the erection. The first one is the herpes simplex virus, HSV. Multiple studies have shed the light on the role of the herpes virus in the context of erectile dysfunction. Beyond its usual characteristic manifestations, the HSV can persist in the body, fostering the state of chronic low-grade inflammation. This sustained inflammation over time can contribute to development of the progression of erectile dysfunction by adversely affecting the vascular and neural pathways, crucial for optimum sexual function. The second one is cytomegalovirus. Well, cytomegalovirus is a very common virus that usually causes mild or no symptoms in healthy individuals. However, cytomegalovirus can lead to systemic inflammation in cases of immunocompromised individuals or those with chronic conditions. And just like in herpes, this chronic inflammation can contribute to blood vessels' health and cause erectile dysfunction. The same, by the way, effects on our vascular system can have the hepatitis C virus. Another very common virus is Epstein-Barr virus. It's another member of the herpes virus family and has been linked to chronic fatigue syndrome and autoimmune disorders. Chronic activation of the immune system due to the Epstein-Barr virus may contribute to the systemic inflammation, and again, inflammation turns and can affect the blood vessels and neural pathways, and just like with other viruses, potentially playing a crucial role in development of erectile dysfunction. Varicella zoster virus, another member of the herpes virus family, causes chickenpox in kids and can later reactively cause the shingles. The reaction to the virus could also impact blood vessels and nerves and contribute to erectile dysfunctions like in other cases. Human immunodeficiency virus, known as HIV, which is a primary affects the immune system, may contribute to erectile dysfunction through multiple pathways. The virus can cause chronic inflammation and affect blood vessels, leading to vascular issues that compromises blood flow to the genital area. Additionally, the medications that are commonly used for treatment of HIV may have side effects that impact the sexual function as well. Now we come to more recent events, and we're going to be talking about the SARS-CoV viruses. One that is currently being studied by multiple institutions across the world is erectile dysfunction. A connection has been reported in hundreds of papers by scientists in Europe, North America, as well as Egypt, Turkey, Iran, and Thailand. Preliminary studies show about 20% increase in incidence of erectile dysfunction in men who have had COVID-19 compared to men who had not had COVID-19 virus. A brand new University of Florida health study found that men with COVID-19 are more than 3 times likely to be diagnosed with erectile dysfunction than those who are not sickened by this coronavirus. This paper adds to emerging evidence that COVID-19 might impact sexual function much more than we previously thought, and there are multiple theories why. One of the new theories that COVID-19 can cause a decrease in testosterone levels that could potentially cause erectile dysfunction. Another theory that there can be also a nerve component and COVID-19 can attack the autoimmune nervous system. Recent studies showed that the initiation, intimacy, and rigidity of the penile erection are controlled by 2 sections of the autonomic nervous system, known as parasympathetic nervous system and sympathetic nervous system. In the beginning, parasympathetic system increases the blood flow into the cavernous tissue of the penis, allowing the erection to occur. As the sexual arousal increases, the sympathetic nervous system takes over until the ejaculation. Some research is speculating that erectile dysfunction may be linked to well-documented loss of ability to taste and smell experiences by COVID patients because these senses play a very important role in a sexual arousal. But the latest and most prominent research has shown a major effect of COVID on the endothelial tissue, the lining, the inner lining of the blood vessels and the heart, and damage of that endothelial tissue causing early atherosclerotic changes and erectile dysfunction. Endothelial dysfunction is a key factor in development of heart and circulatory conditions, pathological conditions. By triggering the endothelial damage, coronavirus infection may cause an abnormal blood clotting, leaky vessels, and reduced blood flow in general. This endothelial effects could have consequences everywhere, from head to toe, but the vascular problems can manifest in sexual organs first because the vessels are so tidy. The arteries of your penis is 1/10 the size of the coronary artery around your heart. And when you have narrowed blood vessels, it will show up there first, years before you see it in the larger arteries or veins. Another reason why the virus can cause the erectile dysfunction is because of the blood vessel leakage due to the massive infection called sepsis. Sepsis occurs when the body works too hard to fight the infection, and taking over the immune system harms a patient's own tissue as a collateral damage. As a result, blood vessels can become leaky and major organs cannot get enough oxygen, nutrients, what they require to sustain a proper activity in life. Now, I know you're probably asking the most logical question: how long does erectile dysfunction last after COVID-19? Well, the truth is we don't know. It depends upon what's causing it in the first place. Just like in other symptoms of COVID-19, some people are experiencing long-lasting symptoms like brain fog, fatigue, shortness of breath, months and months after they recover from virus. So unfortunately, for some, erectile dysfunction could be a long-term symptoms. While larger blood vessels will be developing atherosclerosis and plaques, the smaller capillaries will simply fibrose and disappear, reducing the blood flow to the cavernous tissue of the penis, therefore affecting erection as well as the penis size. The conventional medical approach to treatment of erectile dysfunction is the use of vasoactive drugs. There are several of them on the market: PDE5 inhibitors, sildenafil, vardenafil, tadalafil, and evenamil. Even though these medications can be effective in the beginning and give a man an ability to have an erection, besides its multiple side effects, it's important to understand that they are not treating a root cause of the problem or reversing any of these conditions. More so, once your body gets used to them, it loses its effectiveness. The alternative treatment options are there as well, and primarily use of shockwave therapy as well as the PRP and exosomes injections. The extracorporeal shockwave therapy has an amazing effect on soft tissue. and its primary effect is disintegration of the scar tissue. All the scar tissue, fibrous adhesions that caused by a chronic inflammation, the scarring within the walls of the blood vessels, something that being called atherosclerotic changes. It literally disintegrates it, and the muscle, the wall of the blood vessel is a muscle, so that muscle can go back to its proper normal function, which is pumping. We need that pumping function in order to push the blood through. It also breaks the adhesions, the internal adhesions and plaques within the blood vessel. At the same time, it causes something called neovascularization. By creating a microtrauma around the capillaries, it forces your body to produce new capillaries, therefore revascularizing the cavernous tissue and returning all these little creases of the sponge of the cavernous tissue back into life by bringing the blood in those areas. The PRP, the platelets-enriched plasma, which are your stem cells of your blood, they act as a booster. They create a turbo boosting production of the blood vessels. Again, it causes neovascularization, causes your body to produce new healthy capillaries, therefore revascularizing the tissue. Exosomes work similar to PRP in my experience, and I had it done on myself, significantly more active, even though they're much more expensive. It feels that they act faster, and they also seem to look for problems versus the PRP has to be brought into the problem area to react. Exosomes have systemic effect as well as the local effect. And that's, I would say, a primary difference. You need to understand that these are regenerative options. That's what causes regeneration of the blood circulation, therefore regenerates the blood flow and returns the erection back. That's a long-term change. Now, it is important to mention that the sooner you address the problem, the faster and easier it would be to recover and restore your erection. If you have noticed any major changes in your erection after being sick with any of these viruses and looking to restore your erection, feel free to call in and schedule your appointment in person or over the phone, and we'll be happy to speak to you and hopefully help you to recover as fast as possible. If you have already found the cause of your erectile dysfunction, which is based on the viral infection, the first thing you need to do is to get rid of the virus. Next, you need to check your testosterone levels and levels of other hormones in your body. Hormonal imbalances, which result from the virus infection or other health conditions, may be addressed through the holistic hormonal therapy. You don't need to go straight to replacement therapy. Balancing hormones, including testosterone, is crucial for maintaining your sexual health. And finally, make some lifestyle changes and modifications. Regular exercise, a balanced diet, and adequate sleep contributes to overall well-being, positively impacting immune function, hormonal balance, and vascular health. If you are confident that you are completely healthy, but you still experiencing some early symptoms of erectile dysfunction, then you can fix your problem by taking some great supplements that will keep your male health in good condition. I'm personally taking some of the supplements and always recommend them to my patients. In this video, I will tell you all you need to know about all of the great supplements and how they can help you. Watch this video if you want to improve your erection.